You're still watching the City of Lagos TV show on TV Nigeria. Welcome to Health Lagos. This is one very strategic and informative platform where we, of course, inform and educate Lagosians and various stakeholders in the Lagos State health sector. Health is one of the very vital pillar of the Teams Plus agenda. But there is also a very critical agency that is saddled with the responsibility of ensuring that health institutions, practitioners are well regulated and well supervised. That very strategic agency is the Lagos State Health Facilities Monitoring and Accreditation Agency, HEFAMAA. And of course, the whole essence is to find out and verify the level of efforts, initiatives, and achievements of the agency in fulfilling its core vision, mandate, and of course, values. It's my pleasure to welcome the Executive Secretary of HEFAMAA, Dr. Abiola Idowu. Madam, thank you very much for coming on the program.
Thank you for inviting me.
It's a pleasure.
Yeah.
Let's start from your core mandate, vision, and mission statement of the agency.
Facilities Monitoring and Accreditation Agency was established by the Health Sector Reform Law of 2006. At that time, there was a gradual decline in the general state of health and the quality of care. And there was a lot of infiltration of quacks. So the agency was set up to improve the quality of care by setting standards for the practice of all health facilities and then ensuring that these health facilities comply with the standards that have been set through monitoring and inspection and consequently accreditation of these facilities. Our core mandate is that we visit each facility for monitoring at least twice in a year. Our vision is to be the foremost reputable agency in West Africa. And our mission is to ensure that all health facilities are providing safe care to the citizens of Lagos State.
Thank you very much. Now, Executive Secretary, what are the required minimum standards for the operation of public and private health facilities in Lagos State, as well as accreditation, inspection, monitoring, and licensing of health facilities?
Basic licensure. For example, hospitals, we have clinics, laboratories, diagnostic centers, cosmetic surgery clinics, a whole lot of them. So all the standards in terms of the number of healthcare personnel that they must have, the ambience and the way the health facility is supposed to, be laid out, the processes in the hospital, everything is in the standards. So for example, if it is a hospital, for example, since the person in charge will be a doctor, the doctor must be a fit and proper person. There must be at least a matron in charge. They must have at least a minimum of 3 registered nurses. I'm just giving you an example of the standard of a hospital. And then they must have all the requirements from government that, all the appropriate requirements. For example, they must be approved. Their building must be approved by government. They must have approval in terms of, for example, their fire equipment. They must have approval from LOMA, that LOMA will be picking up their medical waste. Every approval that is relevant. And then the layout of the facility must be such that it is conducive for providing safe health care. We verify this with the aid of tools. We have tools to say, okay, you have this, you have that, you have this. And at the end of the day, when we are satisfied with state of the facility, we issue a certificate of registration.
Like you said earlier, there are quacks and there are efforts by your agency to check that as well. So what is the monitoring mechanism to ensure that these health institutions, either private or public, are actually adhering strictly to your expectations?
By law, every health facility must register with the agency. Section 60 of the Health Sector Reform Law says that. And the process of registration is you put your documentation online. We have a registration platform called the HEFAMAA, where you put up all your documentation, you upload your documentation. When your documentation is satisfactory, we set out to go out for inspection. And if the facility is approved, we issue a certificate of registration, like I mentioned earlier before. We also carry out monitoring of all health facilities. So if the facility is registered, our mandate is that we'll visit it at least twice a year to ensure that they are complying with the standards that we registered them for. If a facility is not registered, it means the facility is illegal and they don't have any business operating. So facilities like that, we often shut them down. But if the facility is okay, satisfactory, then we set out and encourage, if you want to continue to practice, you need to register.
Madam, let's look at very significant achievements, efforts and initiatives of HEFAMAA under your leadership and, of course, in a larger picture, under the Governor Babajide Sanwo-Olu administration.
In the last 4 or 5 years, the agency has made remarkable achievements under the leadership of Mr. Governor, Mr. Babajide Sanwo-Olu. First and foremost, we were able to set up fully as an agency, and then we were equipped with monitoring vehicles so that our monitoring increased significantly, as much as 50%. And then Mr. Governor approved that we also outsource our monitoring activities to franchisees. They are reputable organizations who carry out the monitoring activities for us so that we're able to meet our mandate of ensuring that we visit registered facilities at least twice in a year. In the past, for example, I inherited over 500 facilities that had applied for registration that they couldn't go out to visit these facilities because of constraints of the fueling. So we were able to clear all that. That was a remarkable achievement. Within the last few years, we have registered not less than 2,000 health facilities. Recently, we have also developed what we call QR codes for health facilities so that the general public can give us feedback. So by February this year, we're going to be distributing these QR codes to all registered health facilities to ensure that general public can easily give us information. If they go to a facility and they are displeased, or they feel that they have interacted or been treated by quack or persons that are not qualified to give service, they can quickly, let the agency know that this is what has occurred. And then, of course, the ease of doing business, where providers are now able to interact with the agency through the electronic means. They can register and renew their processes even without coming to our office. We were very relevant during COVID. All the laboratories that carried out the COVID tests, the agency was the one that inspected and gave them approvals. Then we have also started the accreditation process. That is a recognition, international recognition now as an agency, even though the law has conferred on us the ability to give accreditation to facilities. We also want to be recognized internationally so that we can, if we so desire, carry out our accreditation to West Africa. It's quite important to say that apart from all the critical achievements that I had mentioned, that no other state in Nigeria has a full-fledged agency for monitoring accreditation. And all the other states that are coming on, at least 13 states, came to understudy the agency so that they can also establish their own accreditation agency. And I'm also aware that the federal government is trying to is trying to establish something like HEFAMAA so that every state of the federation also has an accreditation agency.
An agency of this nature, You are more like a policing organization for private and health institutions. It is very critical to also ascertain how well trained is your workforce, talking about your human capacity building within the team. So, how would you appraise the level of workforce you have in trying to make sure that you're able to operate at expected standard?
As an agency, we have different cadre of staff, from the administrative to the finance, the procurement, and then of course we have the core staff. So last year, for example, every member of staff from the senior category were trained in their core areas. And then outside of that, staff that are actually, delivering the services for our core mandates were also trained. Some are trained as quality assessors, but everybody was trained on quality improvement.
Would it be right to say that HEFAMAA has actually aligned itself with the Teams Plus agenda of Mr. Governor?
Certainly, because we know that health is a key component of the Teams Plus agenda. The World Health Organization, for example, said that as much as 40% of the care that is given is wasted because of poor quality. Yeah. So if we can assure that the quality of care we're giving is optimal, one, you would encourage people to visit health facilities, and two, you would reduce wastage.
When you have reliable, verifiable data, it makes your job easy. So give us a reliable statistical data of private and public health facilities under your watch. And how have you successfully carried out, of course, the inspection, supervision, and evaluation to meet up standard?
The agency has registered about 5,376 health facilities, but it is not all these facilities that were registered that are currently on our register, because we assume that only facilities that have renewed their registration that are registered. So as we speak, we have only 1,926 health facilities that are in good standing. But I'm sure that as the year is progressing, we would have more that are in good standing. You have to be in good standing before we can actually say you are registered. But we have registered, so there are two different things. So for the monitoring, they were able to visit all the facilities that were registered, about 30%, 994 twice. In year 2023, they visited 83% registered health facilities, at least twice. Then last year, there was a dip. And I think it was understandable because of the pressure of the economy and the current realities. The monitoring went down to 57%. But that is still an improvement from what we used to have when we were only working as the agency to carry out monitoring.
Of course, the Ministry of Health is your parent ministry, but there is also the possibility of synergy and collaboration with other MDAs to deliver on your mandate. So which of these MDAs do you collaborate with?
I mentioned that they have to get all relevant approvals. So, for example, you want to register a health facility, whatever type of health facility, you have to have at least the proprietor or the operating officer, the person in charge, must be registered with LASRA. And then, for example, you want to register an ambulance service, you have to register with Ministry of Transport to ensure that that ambulance will not be breaking down, it's viable. We work with LOMA because LOMA would remove both medical and domestic waste. They must get certification from LOMA. Then we work closely with the Board of Traditional Medicine. We do co-regulation, and then we do joint monitoring. If you need to get any approval from government, we ensure that you get it before we give you certification.
What are the critical areas of challenges for HEFAMAA?
The critical areas really staffing. We still need more assessors. We need quality assessors, those who are grounded in quality, who can actually carry out inspections and monitoring. Because when you carry out inspection and monitoring, you apply it too. But then you also need to let the facility know that these are the areas where you have infractions and this is what we want you to do. Of course, we need more vehicles for hard to reach areas.
A lot of people want to make inquiries on what they need to do. So what are your social media platforms? And if there are hotlines they can reach HEFAMAA on, maybe you can tell us.
Thank you very much. Okay, so I will first of all say that we at HEFAMAA, we recognize our stakeholders. However, recognizing that the general public was a critical stakeholder, it took us a while. And it is one of the things that we're focusing on in 2025. That is one of the things that informed the development of the QR codes, so that they can interact with us more easily. But then we also have social media handles. Facebook, it's at HEFAMAA. Twitter, it's at HEFAMAA_LASG. The LinkedIn at HEFAMAA. Instagram at HEFAMAA 2020. And we have email addresses, hefama@lagosstate.gov.ng or hefamaamail@gmail.com. We want people to interact with us very freely.
Does HEFAMAA hold occasional stakeholders meeting? Because as a monitoring agency and supervisory agency, there is need for periodical stakeholders, seminars, workshops, where you are able to educate these operators. Do you have such?
We meet with our stakeholders on a quarterly basis. If any new thing is coming up, we let the stakeholders know. So, for example, the professional associations and the facility operators and the professional bodies, because they're also stakeholders. For example, the Nursing and Midwifery Council of Nigeria, the Radiographers Board, they are stakeholders. We have a very good working relationship with them. The Medical and Dental Council of Nigeria. We also carry out like educative seminars for the providers. In recent times, what we do is we also carry out town hall meetings at all the local government areas, and we carry out sensitization and awareness, letting them know. And what we do is we carry our logo to say, if you do not see this logo in a health facility, don't visit. In recent times, we invite the other regulators, for example, the police, so that they are aware of our activities. And they are aware that some facilities that are not recognized are those that do not have logos. If they have any information, they come to us. And it has been working.
Dr. Abiola Idowu, the Executive Secretary of the Lagos State Health Facility Monitoring and Accreditation Agency. It's been quite expository, letting us to know the very major significant efforts and initiatives by the agency in order to live up to its core mandate, vision, and mission statement. What are the future progressive plans for the agency for Lagosians?
The immediate one, registered health facilities would have QR codes that the citizens can interact with. If they have complaints, that is the immediate. And then in the future, we're hoping that you just pick up your smartphone, Google health facilities, their location, like health facilities near me. Google their location, and once you Google their location, their services that they render will come up. So, and it would only be facilities that are recognized by government.
How do you want to describe Governor Babajide Sanwo-Olu's support for the agency?
Mr. Governor, Mr. Babajide Sanwo-Olu has been very supportive. If you recall, I mentioned earlier that it was during his first tenure that the agency became fully established, and we were given more staff. He approved the outsourcing of our monitoring activities to reputable organizations. We were giving monitoring vehicles. We were giving 5. Those are, critical achievements.
On a final note, any word of encouragement, assurance to all stakeholders partners and Lagosians in general?
For our stakeholders, the public, we want to encourage you that if you see something, you say something. And if you say something, we will do something. That is the assurance that we're giving you, that the government of Mr. Governor Babajide Sanwo-Olu, it wants to give you assurance on the quality of care that you get in all health facilities. The only way we can do something is if you come up to us and tell us what you have seen, and we'll do something if you reach out to us on our social media handles at HEFAMAA or at HEFAMAA_LASG, email at lagosstate.gov.ng or hefamamail@gmail.com, or on our numbers 090 156 37023, 090 5727 3396. And then for the healthcare providers, we want to encourage you to continue to comply with the standards that have been set.
Dr. Abiola Idowu, who of course happens to be the Executive Secretary. It's been quite interesting ascertaining the level of achievements and positive impact being made by the agency to deliver on its core mandate, vision, and mission statement. And of course, when it has to do with quality healthcare delivery, I want to believe that HEFAMAA has a better and a good deal for Lagosians.